Welcome. Today we're going to delve into a serious but manageable illness, typhoid fever. Let's explore its causes, symptoms, diagnostic tests, and treatment options. Typhoid, is also called enteric fever, is caused by Salmonella typhi bacterium. It infects small intestine. Typhoid fever is highly contagious. It causes a high fever, stomach pain, flu-like symptoms, and diarrhea. More common in developing countries, Southeast Asia and Africa. Causes and route of transmission. Typhoid fever is caused by the bacterium Salmonella typhi. It lives in the bloodstream and intestine of infected people and can contaminate food and water. Mode of transmission, fecal-oral route or urine-oral route. Poor hygiene sanitation, not washing hand properly. Poor human waste management and water treatment. Unpasteurized milk or juice can be a source of spread. Symptoms of typhoid fever usually appear 1 to 3 weeks after exposure. Let's discuss common symptoms one by one. High fever, persistent fever that can reach up to 103-104 degrees, 39-40 degrees. Weakness, generalized weakness and fatigue. Stomach pain, abdominal discomfort, often located in the lower abdomen. Headache, continuous headache, sometimes severe. Loss of appetite, constipation or diarrhea. Rose spots, small pink flat spots on the chest and abdomen. Enlarged spleen and liver, detected during a physical exam. Diagnosis of typhoid fever often involves laboratory tests like IgM test, blood culture, real-time, PCR, stool culture. Fortunately, typhoid fever is treatable with antibiotics include ciprofloxacin, azithromycin, or ceftriaxone. These medications kill the bacteria responsible for the infection. Hydration. It's crucial to stay hydrated by drinking plenty of fluids to replace those lost through sweating, diarrhea, or vomiting. Rest. Adequate rest helps the body fight off the infection and recover more quickly. Hospitalization. Severe cases may require hospitalization, especially if complications such as intestinal perforation occur. In the hospital, intravenous fluids and antibiotics can be administered. The good news is we can prevent ourselves from typhoid by using following methods. Vaccination against Salmonella. Typhi, to prevent typhoid fever. Inactivated typhoid vaccine. A booster dose is required after every 2 years. Can be given to children 2 years or older. Hygiene. Practicing good hygiene, such as washing hands thoroughly with soap and water before eating or preparing food, can help prevent the spread of the bacteria. Food safety. Avoiding contaminated food and water, especially when traveling to areas with poor sanitation, is essential for prevention. Typhoid fever is a serious illness, but with early diagnosis and appropriate treatment, most people recover completely. Remember to practice good hygiene, including hand washing and consuming safe food and water. If you experience symptoms or suspect typhoid fever, seek medical attention promptly. Stay informed, stay healthy. I hope you have understood typhoid disease very well. Subscribe my channel to get notification of my new informative videos. Thank you.